Adverse childhood experiences can reverberate all through a person's life. That's why service providers say it's vitally important to invest in early childhood supports and supports for adults who've been through traumatic experiences.
That was the focus of a forum today, hosted by Community Safety and Wellbeing Thunder Bay and the District Health Unit. Josh Morano was there.
It's part of a plan to make Thunder Bay a safer, healthier, and more equitable community. Community partners gathered on Thursday at the second annual Community Safety and Wellbeing Forum to discuss adverse childhood experiences, how to prevent them, and how to make those who've gone through them more resilient.
I think there really needs to be a paradigm shift away from looking at people perhaps in our community who might be struggling and saying, what's wrong with you, to what happened to you. And so really approaching our work in a more compassionate and kind and supportive way, recognizing that many people are in specific or certain situations not by choice.
That's why organizers say it's so important for people and governments to invest in children at a young age. For Children's Center of Thunder Bay CEO Diane Walker, that means universal childcare. She believes this will help not only children and their families, but society as a whole.
You see, learning doesn't start at age 6 in school. Learning starts at birth. And we need to sort of rethink that kind of framework. And there are really important things that happen between birth and 6 before a child ever hits school. Good childcare also involves a family. It can have food programs. It can have an ability to identify early if there's learning difficulties or disabilities.
What communities need to do and where we need to invest in order to both prevent and mitigate those impacts. I don't think we're doing a great job at really doing that. And we haven't done that in the past. And I believe that that's in part why we have to continue to be so reactive.
Walker says it's just as important to focus on the mental well-being of a child as it is to focus on the physical well-being. That, she insists, takes better funding and better government policy. Josh Morano, TVT News.